The COVID-19 cases are rising and the hospital healthcare system is already overwhelmed with the high number of patients. So the only way forward is to get the home treatment right. Friends, we as doctors have much more information and knowledge as compared to what we had about 3 to 4 months ago when the pandemic started, and therefore the chances of successfully treating patients now is much higher than what it was earlier. I am trying to tell you that there is no need to panic and don't be scared of the COVID-19 disease. I'll be sharing with you the names of many medicines as well as treatment options so that you are familiar with the terminologies. Of course, with the caveat that they should be used only under the guidance of your family physician or the hospital doctors. What I'm trying to say is, do not panic, don't be scared. What I'm not trying to say is, आग लगे बस्ती में और मैं अपनी मस्ती में. No, that's not what I'm saying. I'm saying we need to take all the precautions according to the knowledge and information that we have and steer our way ahead and get rid of this COVID pandemic from affecting us. So here goes. I will be talking about some of the frequently asked questions like what are the symptoms of the disease, when to get tested, when to be treated at home, when to go to hospital, and what are the various medicines and treatment options, and when will I be free to come out of the home isolation in case I get the disease. Here it is. First of all, what are the symptoms of COVID-19 disease? As you all know, it is caused by coronavirus which got mutated in 2019, therefore it's called COVID-19, and it was declared a pandemic by the WHO in January 2020. This virus belongs to the same coronavirus family which caused SARS and MERS epidemics in the earlier years, and SARS means severe acute respiratory syndrome. So it causes infection in the respiratory system, and these are the symptoms which we get: sore throat, itchiness in the throat, dry cough, loss of sense of taste and smell, and flu symptoms like fever, headache, myalgia, that means pain in the muscles of the body, hands and legs, and backache. And not to forget that 30 to 40% of the patients, they have symptoms of loose stomach or diarrhea. These are also the symptoms. Now, how do you get the infection? Alright, so yes, the virus spreads from one person to the other. Technically, it's not airborne, but it spreads from the infected person to the other. So it's important to avoid people. So the first step to stop the spread of the virus is to take all the precautions which are known to us, like hand washing, social distancing, and wearing a face mask. Hand washing can be done by any soap. There's no special soap requirement, or you can use the alcohol-based hand sanitizers which are very commonly available in the markets nowadays. And 6 feet of social distancing definitely helps, and wearing a mask is helpful, there's no question about it. The new information which we have is that getting the virus from surfaces is not so likely, and you definitely need about 15 to 20 minutes of being in the same area with the person who is infected, and that increases your chances of getting this disease. Alright, so there's not so much to worry about. Then next is what happens if you do get the disease. So if you have these symptoms, the first thing to do is stop all physical activity and isolate yourself at home and inform your family physician. That's very important. Do not self-medicate at all. Why I am saying that you need to stop physical activity is because physical activity makes the body tired, which the virus is doing already, and therefore it increases your breathlessness as the days pass. So stop physical activity, do not lift heavy weights and isolate yourself. Now what you need to do during the isolation? First is you need to understand that certain things have to be monitored, like the pulse, blood pressure, body temperature, and your oxygen saturation of the blood, which can be done by a simple device called pulse oximeter, which attaches to your finger. Okay, the oxygen saturation of a normal person should be 98 or 99 or 100%, but in the cases of coronavirus patients, because the virus affects the lungs, the oxygen saturation starts falling. It falls a bit. Okay, no problem. Just measure your baseline oxygen saturation. Okay, you can do 2 experiments at home. The first one is measure your oxygen saturation, then walk for 6 to 10 minutes inside your home in your room and measure the oxygen saturation again. If it falls 6 to 9%, that means if it was 99 and it becomes 93 or 92, that's not a good sign. Stop walking, stop physical exercise, and start deep breathing exercises, which is deep abdominal breathing exercise of any form that you know, like Anulom Vilom or Kapal Bhati or whatever deep abdominal breathing exercise you are aware. Otherwise you can check it out on the YouTube. So measure your oxygen saturation, then do a deep breathing exercise for 15 to 20 minutes and check again. If the deep breathing exercise increases your oxygen saturation by 3 to 4 percentage points, which means it brings it from 93 to 96 or 97, you are in luck, because this is helping you. Alright. Now, what else can you do at home? Don't think of it as social isolation. Do not lose contact with your friends and family and loved ones. Be on touch on phone and social media. Stay occupied. Do what you always wanted to do but never were able to do in your life because of being busy. Create a better version of yourself during your home isolation and emerge a better version when you come out of isolation. So use this home isolation in case you have to go through it, and don't think of it as that you have been put in jail. That's not the idea. Okay, then the next question is when to get tested. Okay, now this disease develops in 5 to 10 days from after getting infected. The first test to be done is the RT-PCR test, which tests for the virus RNA. Alright, and technically, theoretically, it is supposed to be 100% specific. That means there can be no false positive. Okay, now because it is checking for the RNA of the virus and it is done by nasopharyngeal swab. The charges for this were earlier capped at 4,500 rupees, but now the government has reduced the prices and it is capped at 2,400 rupees for one test. Alright, the next test is the rapid antigen test, which is again nasopharyngeal swab, and it's a rapid test, and the testing is also being taken care of by the government. And the third one is the antibody test, which is done from your blood or the serum, and this is not testing for the virus, but it is testing for our immunity against the virus, and it is of 2 types, IgM and IgG. IgM comes positive earlier and IgG becomes positive later and stays longer with us, and that is our fighting power against the virus. The first test to come positive is the RT-PCR. Theoretically, on the second day it should be positive, but it is best to test after the 4th or 5th day. The antigen test usually comes positive on the 6th or the 7th day, and the antibody test, IgM, comes positive about the 8th or 9th day. But please, these days and this information is not etched in stone. This is an approximate guideline on when the test will come positive. The other tests which should be done are blood tests. The first one is CBC, that is complete blood count, in which the main thing to be seen is the WBCs, or the total leukocyte count. Normal level is 4,000 to 11,000, but in viruses it decreases, and in coronavirus if it is less than 2,000 or 1,000, that's an alarm bell and you need to go to hospital. Otherwise, if it is 3,000, 4,000, 5,000, you can stay at home. The next one is CRP, which is C-reactive protein, which is a test for inflammation. Third is ferritin, because the ferritin levels rise during the COVID-19 disease. And the fourth important test is the D-dimer test, which tests for coagulability of your blood, because this virus causes blood clots. And if the D-dimer is high, then you need to take an injection which is called LMWH, which is low molecular weight heparin. Some of you may be aware of that, because those people who have DVT, that is deep vein thrombosis, have to take this before air travel. And most people can take it themselves, because it is a subcutaneous injection called Clexane of the dosage is 0.6 ml, and it's a pre-filled syringe. But please, it has to be under your guidance of your family physician or the hospital doctor, and I'm just making you aware of the terminology so that you are familiar with it, not that I'm saying that you start doing it yourself. Okay, so these now we come to the medicines which are available. So first step is to build immunity. All right, now the non-specific immunity is the immunity which will make our body strong against all types of infections, including coronavirus, and it's not specific against coronavirus. And that can be done, which is being tried now, by a concoction which includes zinc 50 mg per day, vitamin C 1000 mg per day, and vitamin D 2000 IU, which is international units per day. This is used as prophylaxis for general immunity against viruses, not specific against COVID-19, but it is useful. Coming to specific immunity against coronavirus or COVID-19, well, it doesn't exist because we don't have vaccine for it yet. It is in the developing stage. We don't know when it will be available. So there's no specific immunity against COVID-19 as of now in July 2020. Now we come to the other medicines which would be used for you. If there is fever, you have to take paracetamol. I'm not going into the dosages. For respiratory difficulties, yes, steroids have been approved. So whether it is corticosteroids or Decadron, both have been approved. It has to be obviously under the guidance of your doctor. And inhaled is also available, injectable is also available, and oral is also available. Dosage will be decided by the doctor who is treating you. The other medicine is the anti-malarial hydroxychloroquine, which has also been in the news a lot. And it is used for prophylaxis and for in the early stages of the disease, and it is most people believe that it reduces the severity of the disease as well as the duration of the disease. The next ones are antivirals, so remdesivir, and the other one is the favipiravir, which is the Fabiflu. Both of these have come in the market, and they are also having promising results. The other one is tocilizumab, which is the monoclonal antibody, but this is for hospital use. It's not for the home use. And the other treatment which is now looking quite promising is the convalescent plasma therapy, which is the plasma from people who have already recovered from the COVID-19 disease, is supposed to have antibodies specific against the COVID-19. So in the absence of a vaccine, this one can be used not as a vaccine but as a treatment for patients who are already suffering from this disease. Alright, now what else should you do at home? So one is deep breathing exercise, which is in the form of pranayam or anulom vilom kapalbhati. The other way to do the same thing is to blow into a balloon, or you can take a spirometer, which is used by physiotherapists to blow air into it in elderly people. But anybody, not just elderly but even the youngsters and middle-aged adults can use this to blow air, and what we are doing actually is to help our lungs to breathe better. Another thing which has been found is that if you sleep in the prone position, then the lungs get inflated better, and that is so you can breathe better. So that is also a technique which can be used, which can help you to take care of your lungs. If you have to be hospitalized, God forbid, if your oxygen saturation falls below 90 or 88, or the fever is not subsiding, or there are some other comorbidities, or you are an elderly gentleman or lady because of which the doctor feels that, well, you need to be hospitalized, it's okay. Don't worry, do not panic. The hospitals are equipped with treatment options, and the chances of survival and successfully treating the disease now are much better than earlier. Please remember that. Okay, so now we come to the last part, in which I will tell you when you can come out of your self-isolation from home or in the hospital. There are two ways to look at it. One is, if you get two samples of RT-PCR negative with a minimum gap of 24 hours, then you are free to come out. Two negative samples of RT-PCR make you able to come out of your isolation. The other is the symptomatic approach, in which once the symptoms are over, then you have to wait for 3 days. And symptoms getting over means there is no fever and there is no difficulty in breathing without the use of medicines. Once that happens, then 3 days after that you can come out of your self-isolation. But remember, we are not counting the first 10 days. So if your disease starts on day 0, then first wait for 10 days. After 10 days, if there are no symptoms, then wait for 3 days. So the minimum time which you have to stay in self-isolation is 13 days. If your disease stops after 12 days, then you have to count 3 after that. So that makes it 15 days. So the minimum is 13 days, and the maximum is when your symptoms stop 3 days after that. These are the two ways in which we can decide whether you can come out of home isolation or not. So with all this knowledge and information, hopefully we will be able to treat all this COVID-19 disease much better than earlier. Take care, use all the precautions, and let's fight COVID-19 together. Thank you.